Hello, my name is Kenzie Macneil, and I completed my P4 shadow at the Oro Valley Hospital. To practice as a pharmacist in this setting means collaborating with prescribers, evaluating patients' medication dosages, and considering dose adjustments based on the patient's health status. Pharmacists will confirm the correct drug prescribed for a patient by assessing patient-specific factors, including creatinine clearance rate, age, allergies, immune status, and route of administration. Pharmacists play a key role in hospital pharmacy by ensuring safe and effective medication use, providing clinical expertise, and managing medication storage and distribution. A typical day for a pharmacist in this setting involves reviewing prescriptions, documenting patient medications, and adjusting doses. Pharmacists must also compound IV drugs per request in a highly regulated and sterilized room, which may be needed multiple times throughout the day. Overall, most of the day is spent sitting at a computer verifying prescriptions and managing patient medications. The duties of a pharmacist in this setting include verifying prescriptions, documenting medication changes for patients, and compounding these IV solutions. Another responsibility of the pharmacist is to communicate with doctors and nurses via the pharmacy phone regarding questions on drug administration, side effects, and correct dosing. A pharmacist may also assist with other responsibilities, such as performing technician duties, including filling prescriptions and managing inventory. According to the current employees at the Oro Valley Hospital's pharmacy, a residency or specialized training is not required to be hired as a pharmacist. However, this does not apply to all hospital pharmacist positions, as each hospital has its own rules and required qualifications. My P4 student performs medication verification, patient documentation, and technician responsibilities under the pharmacist on duty. She also works on her projects and studies for the NAPLIX during downtime. Other daily responsibilities of my P4 student include helping out with tech work, such as filling prescriptions and delivering them to the Pyxis med stations throughout the hospital. And her hours consist of 7 a.m. to 3:30 p.m. every day, with a 30-minute lunch break. Two projects that my P4 student is currently working on are a clinical assessment of TPN, also known as total parenteral nutrition, and a drug study on fomepizole. She is unsure whether she wants to work here after graduation, as she's still figuring out what kind of practice she wants to do as a pharmacist. She says she would prefer a position with more direct patient care, which is very limited for pharmacists at a small hospital like Oro Valley. The advice that my P4 student gave me to succeed on rotations is to always be on time, be professional, and be eager to learn. Personally, I'm not interested in completing an APPE rotation at this site because it also lacked the direct patient care that I am looking for, and it was a slow-paced environment. While I liked many of the opportunities to apply clinical knowledge, I prefer faster-paced work environments and counseling patients directly about their medications. Um, I'm still interested in hospital pharmacy as a career, but like I said, I would prefer a faster paced, higher volume hospital with less downtime day to day. I'm interested in learning more about how the responsibilities of hospital pharmacists vary from hospital to hospital and whether these opportunities exist for hospital pharmacists to engage more with patients. Thank you.